My apologies for any dog-related sounds. Daisy is currently on one right here, just being herself, so my apologies. Hey friends, welcome back to the channel and welcome to this video. My name is Steven and I'm a third-year dental student. Not only am I a third-year dental student, but I am a third-year second semester dental school. As yes, this is the official recap video for my D3 fall semester in dental school. I do these every semester. I do a video where I just go in and kind of casually talk about everything that happened throughout the semester and give you guys sort of a retrospective recap. And it's funny because the first semester of dental school, I remember I filmed my recap retrospective video directly after finishing my final exam. I finished my final, I turned around from my desk and set up the camera and I filmed the video. This semester has been a little bit different. My last semester actually ended a few weeks ago and I'm actually now into my D3 spring semester as I sit here and film this video. Life has just gotten insane, which will obviously be part of this particular video. So this video has gotten pushed back a bit. But yeah, this is the recap video. I'm gonna get into everything that kind of went down this semester. I have made a couple of videos in the past few weeks that if you're interested in the third year of dental school, these videos will give you a better idea of what it was like. Dove into two specific topics a little bit more deeply. So clinic talked all about the specifics of surviving clinic. That is a video that I highly recommend. And then also the busy schedule of a third year dental student. So I'll leave those videos linked in the description below if you want to see those. Once again, check them out if you're more interested in the specifics of some of this stuff. But this is going to be a video where I just discuss kind of the overall thoughts of the semester, what happened, how did it go, and where are we looking to head in the future. If you enjoy it and you want to see more, make sure you subscribe and like this video. I really don't even know if I want to have all that much structure in this video. I kind of just want this to be a simple sit down and talk with all of you about just this semester as a whole, because I do think that I've always made sort of a big point in the past about how the semesters have progressed and which semester is more difficult than the others and things like this. And it's funny because each time I do one of these videos, I always make the claim that the particular semester that I'm talking about was the hardest semester of dental school for me. And yet again, I feel that way because D3 fall was an absolute it was an explosive semester, we'll say that. There was so much happening, there was so much going on. It was an absolute change in so many ways, and I really had to learn to adjust and just to survive the whole thing. I've said this many times on the channel, but I'll reiterate it here. If you're unfamiliar with the layout of dental school and how it works, at least in the United States, we have 2 years of lecture and lab-based school. So we're in the lecture hall learning a bunch of material, and then we're also in our preclinical labs, basically doing a lot of the things that you can simulate on fake teeth, plastic teeth, fake mannequin heads and such. And then the second 2 years, the third and fourth years of dental school are our clinical years, wherein we go to a actual real dental clinic and we become dentists, essentially, dental practitioners, working with our own patients and actually doing dentistry. So this particular semester was my first semester being in the clinic as a dental student. And obviously that means this was the biggest change I've experienced in dental school since the start of dental school. I've said this in the past, but it felt like the first 2 years were kind of like undergrad, but just with more dentistry specific things kind of overlaid in. Whereas this semester really felt like I was actually for the first time working as a dentist, but also taking a bunch of kind of night classes on the side. In other words, I felt like I had a full-time job, but was also a student at the same time. That alone made things really difficult because clinic feels like the most important thing you're doing. For the first time in your career, you're actually treating other people, and what you do day to day has a great impact on the lives of many people. So that feels like the most important thing, but you also have the school side of things where you're taking courses that count towards your GPA and that actually matter. And you also have other things that kind of surround both. You have lab work that you have to do that supports clinic, and you also have other courses that are popping up where those require lab work and projects and things on the outside. It was just by far my busiest semester, and this is where you kind of get into the discussion of hard versus busy. and which, what is the difference? Is there a difference? I think there definitely is, because while this semester was extremely busy and in many ways hard, I feel like it went by a lot faster than past semesters have because of how much I was doing day to day. And once again, if you want to get into the specifics of the day to day from the semester, you can check out the video that I have linked below where I talk about my schedule. That's a good video just to kind of give you an idea of what we actually did this semester. But it was tough. It was a challenge in many ways. I mean, I was busier than I've ever been. I can't reiterate enough how it felt like. I had a full-time job where I was working you would say 9 to 5, but for me it was more like 7 to 5 every single day, and then going home at night and having to do the various things that were related to our coursework. And that was tough for me. I feel like I'm the type of person that likes the work-life balance. Like, I'm totally cool with a full day of work. It's fine by me. But when I get home, I like to have my hobbies. I like to have my time to myself. It was really difficult for me this semester to get myself to then put in the time to study for various exams and things. And then subsequently, of course, my YouTube channel. I feel like my YouTube channel has definitely taken a major dip in the amount of material that I've been putting out for obvious reasons. I've just been so much more busy, and I've talked about this a little bit recently, and I've had great support from all of you on this matter. But yeah, things have just gotten real, and it's been tougher and tougher for me to put in the time that I want to put into my YouTube videos to keep things going. None of that, though, means that I'm going to stop making YouTube videos, because I've been able to manage it this far and really have been going through tough times in terms of how much I've been doing. So the fact that I've made it this far means I'm going to continue, of course. I love doing this. It is one of my favorite hobbies, if not my favorite. And while it is work in a sense at times, and it requires a lot of time and effort and energy, I do still find a great passion in it, and I'm excited to see how it will continue to progress, because the channel has just grown so much and it's really fun to watch, honestly. It was just tough to balance everything this semester. I mean, school and clinic together made things quite difficult, and I had to just sort of prioritize things. And for me, like, the non-negotiables, of course, I have to do well in clinic and I have to do well in school. But then the next thing for me outside of that is really my family and relationship, and like my friends and all that. The personal connections that I have in my life kind of take precedence. So there were many nights this semester where instead of making a YouTube video, like filming and editing, I would have a long FaceTime call with my girlfriend, because that to me is more important. It's more important to keep my relationship healthy and lasting, as opposed to making a YouTube video. So it was sort of the give and take this semester that I didn't experience in the past. And this semester made me realize how much free time I actually did have in the first couple of years of dental school, mostly because of COVID, just the fact that we were fully online, so I was here all the time, but also too, just there weren't as many responsibilities in the past. Do I think that this semester was extremely difficult and like impossible in any way? Absolutely not. I think that if you make it through the first 2 years of dental school, you are very equipped to get through the third and fourth years of dental school. I can't really speak to the fourth, but I'm sure it'll be that way because everybody sort of makes it. And it's usually the first couple of years when people get tripped up with things. This semester was really just about putting my head down and making sure that I did the work that I needed to do to get by and to do well. The most difficult course that I took this semester was oral pathology. For some people, this was not that difficult a course. For me, it really was, and it caused me to have to like really look at the way I was studying, because my traditional method of just blitzing through a bunch of Anki cards was not working for this course. And it was related to the way that the teachers would ask questions on our exams. Instead of knowing facts, you basically had to connect different things together. So you would get, 4 pathologies in an answer option, and you'd have to figure out what is the common thread between these 4 pathologies. That requires you to know a lot more and to be able to think bigger picture, as opposed to just fact, fact, fact. So Anki didn't work as well for me. I did a lot more visual learning and like mnemonic type learning, just things that I could actually grasp onto so that I could get more of a big picture on all these pathologies. It was quite a unique challenge and ended up doing fine, which was great, but that was the most difficult sort of didactic course that I took this semester. And then once again, clinic took up a ton of time, and if you want to hear more about that process, you can check out my clinic video. There was a lot of difficult things about clinic. I think the most difficult was just understanding what to do, because you get thrown into it legitimately, and no matter how much you try to prepare for that process, you just can't. There's too much to learn, there's too much to know, and your first couple of weeks or even months is really just trying to understand What are you supposed to do for each appointment? What are you supposed to do for your patients? Like, how do you know what they need? It's a long process of trying to learn all of these things, but eventually you start to pick up things. And it's cool because when I was a kid, we used to do this thing at the dinner table where my mom or dad would ask, what was one thing that y'all learned today? That's a good question for around the table, just asking your family. And at school, you'd be like, yeah, I learned how to do division between these types of numbers or whatever. Nowadays, it's funny because every single day in clinic, I learned something new. At least one novel thing I would take home and think, wow, I didn't know that yesterday and now I do. Whether it was like the behind the scenes process of being a dental student in the clinic and just sort of knowing what forms to do and knowing where to go and knowing this and that, or if it was something dental specific, like I learned this clinical thing about endo or operative or oral surgery, whatever it was, every single day in clinic I learned something new, and that is actually really, really cool. I've also said this in the past, but dentistry is about practicing, not about perfecting. And so people that are practicing in their 60s and 70s, they've been doing it for 40, 50 years, whatever the case may be, those people still learn new things each and every day. And that's kind of one of the beauties of dentistry. If you think you're gonna walk in and master it in dental school, you are sadly mistaken, because that will not happen by any means. None of us master it at any point. We just learn more and more, and we get more experienced. And the more we do, the more we see, the kind of better equipped we are to approach the unique scenarios that pop up at us in dentistry. And that is a really, really fun thing to kind of see in yourself as it evolves. This semester was a huge change. I wish that I could have done more to kind of document it in the moment. I still have a large difficulty with filming on campus, and it's gotten a lot more difficult now that I'm actually treating patients. I do want to quickly kind of address the point that's been made in a few of my vlogs. People keep asking if I can film some of my patient interactions in my vlog. This is something I really want to do, but number one, don't even know if it is possible, but number two, think that if it's possible, it's going to take a lot of jumping through hoops. And at this point right now, with everything that I have going on, I just don't necessarily want to push the issue on filming in clinic with patients. Even though I do have a couple of patients that would probably be cool with it, I want to just focus on good patient care. And that's what's important to me right now. The YouTube comes second, but I hope that in my vlogs and in the videos that I make covering clinic, I do a good job after the fact explaining what happened. I get into the specifics, because ultimately it is a learning experience for all of you. That I'm just trying to kind of relay the information that I'm sort of garnering as I go along. And so the important thing is not necessarily seeing the patient interaction, but rather hearing about the important learning points that I came across as I went through it. I am disappointed that I didn't make more videos this semester, but I am proud that I continued to consistently post. Not as consistent as the past, but still consistent nevertheless. And I have a bunch of videos on the slate that I need to make coming up in the future. Starting with a little bit of a spoiler, I'm going to be making a organization video. I've done those in the past and people have enjoyed them, just kind of getting organized both physically and digitally for this semester, because it's extremely important thing to do. Stay organized, get ahead of your schedules, make sure that you have everything neat and in a way that you can understand and you can use and enjoy. And the cool thing about that video is I'll be kind of going into some of the specific things that I'll be altering or changing about the way that I use my personal planner this semester based on what I learned about myself and how I used the planner last semester. That is something I can talk more about in that video. But often when you first start using something like a planner, for me that was last semester, you just kind of throw everything into it, and then by the end of the semester you realize I never really used most of this stuff. So when you go around for part 2 or the 2.0 version of it, you can kind of streamline things and just put the things in there that you're actually going to use. I'll get more specific with that when I go into it in the next video, so stay tuned for that. So yeah, not very structured here, but this was a good semester of dental school. It was another challenging one. It was another one in which I grew and learned a lot. Of course, I meant to talk about this more in like the personal side of things, but I got Daisy. She's right there. I got Daisy at the beginning of the semester, and she has been an absolute blast to just sort of become part of the family. It's been awesome to see her grow up, and I'm glad that I make YouTube videos, because now there's a bunch of video evidence of her being a little tiny puppy and then growing up into the dog that she's becoming now. She's learning a lot. We are training every day, just trying to get her kind of calmed down and sort of centered in on me and my commands and sort of that, because she's a little bit of a wild child. But she's been a pleasure to have, and also I made a video about her, so if you want to see that video, you can check it out right here, just going into the details about Daisy and having a dog in dental school, because I do get questions about that as well. A lot of changes happened this past semester, and things will continue to change moving forward into my D3 spring semester. Really, for me, this semester is all about just getting as much done as possible. I have so many patients and so much dentistry to do. It is insane. I have every single specialty just kind of filled up with a bunch of different patients and their needs, and this semester is going to be insane. I'm going to be doing so much dentistry, and I hope to kind of describe basically all of it to all of you in the best way that I can. All right, I have gone on for far too long. I do appreciate all of the continued support. I appreciate the love and just the fact that you people still watch my videos. It means a lot to me, and it's fun just documenting all of these steps, because I can't wait for 5 years from now when I can go back and watch, look at me after my first semester of dental school, or look at me after my first semester of D3 year. It was all part of the process. It was all worth it. All that hard work paid off. So yeah, awkwardly, I don't know what to say now. I know what to say. I appreciate you all for watching. Thank you again for just being part of all of this. And once again, if you do enjoy dental school content, these types of videos, make sure you subscribe to stay up to date, and also like this video. Let me know what you thought about it. And that's really it, folks. Thanks for being here today. I will see you soon on the channel. And as I always say at the end of my videos, I will see you in the next one.